Okay, I think we should maybe get started. Thank you for joining us tonight. I'd like to open quickly with acknowledging the lands on which I stand, and where the Alzheimer's Society of Toronto makes its home. And I'd like to start that by acknowledging that we gather on the traditional territory of the Wendat, the Anishinaabe, Haudenosaunee, Métis, and Mississaugas of the New Credit. The treaty that was signed for this parcel of land that I'm on is collectively referred to as a Toronto Purchase, and it applies to the lands east of Brown's Line to Woodbine Avenue and north towards Newmarket. So you may be on those same lands with me today, but I welcome you. Much further back, this was known as the Dish with One Spoon territory, and that was a treaty between the Anishinaabe, the Mississaugas, and the Haudenosaunee that bound them to share the territory and protect the lands. My family are newcomers, 5 generations of European settlers on these same lands. And this organization was founded even more recently in 1981. In tonight's conversation, you're going to get a glimpse of how important story and narrative and our history, no matter how painful it is important to share and tell, to respect our common humanity. And I hope that we do the same and offer this acknowledgement when it comes to reconciling the narrative and the story we've told ourselves about the lands that we stand on. So I'd like to welcome everybody and thank you for joining us today. I'm Scott Russell, I'm the Chief Executive Officer of the Alzheimer's Society of Toronto. We provide support and education, counseling, and programming to those living with dementia, as well as family members, friends, and caregivers impacted by the disease. While we've all experienced the challenges in the last 2 years, AST has been able to meet those, serving our clients first and foremost by virtual services, building new platforms, doing things that we've always done, like connect people together through story, through technology. So we do that again tonight through the magic that is Zoom. Today, we are joined by 4 Canadian authors. They'll share their perspectives on dementia through discussion of their respective works, all examining different aspects of the journey, of what it is to care for someone with dementia, what it is to deal with stigma, health, prevention, and all sorts of aspects of this disease. We're gonna cover a lot of ground in the next 90 minutes. So before I introduce our panelists, just a few housekeeping items. We welcome questions that you may have relating to the discussion. Please feel free to post those questions in the Q&A. There's an icon located at the bottom of your screen. And we will have time at the end to address those questions. We'll pull those right out of the Q&A. Please note in your question, if it's directed to a specific panelist, please note who you're asking that question of at the beginning of your comments when you post it. The presentation itself is being recorded. It will be made available to you tomorrow in the follow-up email along with the survey. We encourage you to pass along the link to any colleagues who weren't available to join us today. The webinar is scheduled for 90 minutes, as I mentioned. Our discussion will be the first 60 minutes, and then we'll have 30 minutes set aside for the Q&A. So now that the technical aspects have been taken care of, it's my pleasure to introduce our panelists, Larry Chambers, Christiana, Veronika, Zyss, and Valene Campbell. Each panelist will have an opportunity to discuss their works, and then we will discuss some of the themes that surface from each of those. So I'm going to turn it over to Larry Chambers, who is the former scientific advisor to the Alzheimer's Society of Canada. His research career has contributed to our understanding of many issues for people living with dementia. He's recently returned to his first public health mission, preventing the changes we assume are due to aging and disease by getting the right attitude and fighting back against an environment that makes us inactive. Today, Larry will speak on his book, Increase Your Brain Ability and Reduce Your Risk of Dementia. Thanks for being here, Larry. It's good to see you again.
Thank you very much, Scott. And I'm pleased to say I'm now back with the Alzheimer's Society of Canada as a scientific consultant. So,
welcome back.
Yeah, so it's great. And thanks everyone for coming along to our panel discussion this afternoon. And I'm going to talk about our book. Next slide. So as Scott said, I work in live in Ontario, and actually I live in Milton. And next slide, please. So one of the issues that we came up with having to deal with in our book at the beginning of the book was this issue of the relationship between dementia, Alzheimer's disease, and vascular dementia. And what we found is that not only is there confusion amongst the public about what this is about, our medical colleagues also are generally confused about this. And there are many reasons for that, but one of them is that dementia hasn't been a high profile topic until fairly recently in medical education, training of physicians. But this slide shows that dementia is the larger concept, and then there are different conditions within dementia or diseases. The two that are mentioned here that are most prominent are vascular dementia and Alzheimer's disease, but you see there's quite a few people that have both of those conditions. And even more challenging is that there are a number of people who have all the symptoms of, have no symptoms, I should say, of Alzheimer's disease, but upon death at an autopsy, for example, they are found to have it. And we really don't know very much about how that works, but it would appear that the fitter you are physically and mentally, the more likely it is you'll be able to increase your lifespan so that at the end of it, you have a very short time for social care required. Next slide, please. So the other issue is how do we define dementia? We have public knowledge about, for example, prenatal care. Everyone knows that women shouldn't smoke when they are pregnant, or we have other general public knowledge about it's not a good idea to smoke indoors, for example. But the four things that we think the public should know, all the people in the community should know, that if any of these four items on the slide become problematic with friends or family, looking after your financial affairs, self-care and personal hygiene, cleaning and maintaining a living space so you can live independently, or driving. If any one of those things happen, if you happen to be a bank teller, for example, that can't communicate with a person on the other side of the wicket, dementia, we think, should be something that they should think about. And everyone in the community should know these are the four big functioning areas that lead to problems. And as you notice, there's nothing in there about which condition or which part of the brain or whatever, but these are the things that we have to live with as our friends and colleagues may experience these issues. Next slide. So we wrote this book based on the best evidence we could find. We looked at all the systematic reviews that summarize scientific evidence, and basically came up with the conclusion that there were three important strategies that reduce your risk of dementia. Keeping your tissue healthy, improving the blood supply to your brain, and increasing engagement with other people. And you can get this book. I'll put a plug in on Amazon, for example, and I won't say anything more about that. So just to very briefly talk about the content of the book. Next slide. So the first issue is keeping the brain tissue healthy. And there are these four aspects of that: getting more active and improving physical fitness, reducing stress, sleeping better, and being wary of over medication. So in the book, what we do is we tell you what we suggest that you can do yourself, what friends and family can do, what's available in the community and in the health service, finally, to give you support to do a better job at these four activities or behaviors. Next slide. Next slide. That's it. Okay, so the next one is how do you keep your arteries open? You may be interested to know that there's 400 miles of blood vessels in the brain, and that if you were to spread them all out, it would be the size of a tennis court. So if anything goes wrong with that blood flow, you're going to be at higher risk of dementia. So the way you do that is the miracle cure, which is now well accepted in medicine, that physical activity is extremely important. The worst thing you can do probably is smoke, but keeping your health, maintaining your health, and eating a Mediterranean diet are important behaviors on the left side. And then we have a lot of evidence about how to prevent and treat high blood pressure, type 2 diabetes, high cholesterol, atrial fibrillation, and many stroke. And what we do in the book, again, is we say, what can you do to prevent these things yourself? How can your families and friends help you? What's available in the community, and how could the health service help you? For example, there's pretty good medication for blood pressure, and if you every time you go to the physician, your family doctor, he or she should take your blood pressure, for example. Next slide. And then finally, what are the sources of support for people who want to keep engaged and purposeful? So part of this is keeping your sight and hearing sharp, staying mentally alert by learning new hobbies, reading or solving crossword puzzles, and staying actively socially for attending community activities, faith groups, or support groups. My wife belongs to on the board of an organization where it's very difficult to get them to agree to things. And I tell her, well, you're using your brain in that activity, so you're benefiting from it, even though you're frustrated. So we can help people with helping them. We discuss things in the book about what you can do yourself on these activities, what your friends and family can do, and in the community, what's available to help you, and then in the health service. Next slide. So that's my quick story. The book has all the answers about how the ways in which you can support those three major topics: keeping your tissue healthy, keeping your blood flow in the brain going. It's just all the things we do for the heart, for example. We also benefit the brain. And then finally, how do we keep engaged meaningfully? So that's my story, and please to answer any questions or participate in this discussion with the other panel members. Thank you.
Thanks so much, Larry. That was great. Well, there'll be more from Larry. If you have a question for him, please tap the button below on Q&A. If it's specifically for Larry, you can just say Larry : and ask your question. We'll get to that definitely when we go through the rest of the panelists and we get to the Q&A section. Now I'm happy to introduce Christiana Eggy, who is a partner of the Alzheimer's Society of Toronto. We've worked with Christiana and her team for a number of years. She's a registered nurse, diabetes educator, registered natural health nutritionist, geriatric and mental health specialist, mother and grandmother. She's always trying to help and inform others. I've seen her on the TV and radio for the last couple of months, like nobody's business. She is out there informing others. For the last 23 years, she's owned and operated Alexis Lodge retirement facilities in Toronto, Canada. It's a business she started with her late husband, Anthony. Their mission is to impact the lives of individuals with Alzheimer's disease and other types of dementia, and focus on providing person-centered care, putting the individual first and giving them a place to call home. Today, Christiana will speak on her book, A Rose for Grandma, A Journey Through Alzheimer's. So I'm going to turn it over to Christiana.
Thank you so much, Scott, for the introduction. I'm happy to be a part of this wonderful panel. The inspiration for my book actually started over 35 years ago in my first year as a nursing student. On our first mental health rotation to a chronic psychiatric hospital in Benin City, Nigeria, it was preceded by horrors and stories of things that really scared us. But upon arrival at that facility, we were shocked to see that the patients were just like us. It turned out to be my best rotation ever. And I was saddened, though, by the stigma that surrounded these patients. And I made a mental note that I would do my best to try to help eradicate the stigma around mental illness. After graduating, I had the opportunity to come to Canada, and I thought for sure it would be different here. However, I was sadly mistaken because the stigma around mental health is a global issue. I was blessed to start my career out at the Center for Addictions and Mental Health. I worked on the crisis unit there for 10 years. And the conditions in which some of the patients who come to the hospital consistently broke my heart. And I would go home and vent to my husband, who would listen patiently and reassure me, because I felt that if these patients had enough supportive housing, that they'll be able to stay out for longer and have better quality of life. So after the birth of my third child, Alexis, my husband helped that dream come true. So together we started Alexis Lodge Retirement Residence, a home that was created to help people experiencing Alzheimer's and other types of dementia have a different experience, to have a secure, comfortable, supportive, loving home that will enhance their abilities, their dignity, and their individuality. And so we did that, and we've been very successful at it for the past 23 years. However, the pain in my heart continued to swell, because it is not uncommon for people with dementia not to have family involvement. As a result of the hard journey of coping, stress, and challenges that they face, which eventually leads to caregiver burnout. So in my book, A Rose for Grandma, I, tapped into my years of experience to present real life stories that people can relate to and lessons, so that people can learn about what dementia really is, get educated, and increase awareness. In the book, it takes you from the onset of dementia, when families are struggling and fearful and also in denial with the behaviors their family members are starting to exhibit, to the devastation of a diagnosis of Alzheimer's. And Annie exemplifies, and her family exemplifies what, going through the dementia journey together as a family can do. It will help to make the journey easier, and also ward off caregiver burnout. So the illustrations in my book were intentionally chosen to be representative of the Black community. As a Black woman, it's important for me that my writing reflect the diversity that I know to be true in my life. In a world where there's shortage of Black stories being told, particularly here in Canada, and the few that do receive a platform are almost exclusively centered around racially oriented trauma. It has always been my desire to highlight the regular everyday stories and challenges of the Black community, and to make clear that the everyday stories of Black people deserve to be told as well. So that is a summary of my book, and I'll be happy to answer any questions.
Thanks so much, Christiana. It's great to, and I don't know why I didn't ask before, but now I know where the name of Alexis Lodge comes from. So thanks for sharing.
Yeah.
Thank you for sharing that. So the link is in the chat for the book on Amazon. Christiana will be here to answer more questions during the Q&A coming up in 10 minutes if you're just joining us. If you have a question, please feel free to drop it in the chat under the Q&A button at the bottom. And if it's for a specific panelist, just drop their name in there ahead of time, and that'll help me route the right question. Otherwise, I'm just going to lob it up. Whoever grabs it, grabs it. One of the folks that might grab the question might be Veronika Zyss, who also joins us today to talk about a book that she's written. She began her writing career just before her 58th birthday, prompted by a family tragedy. She's a master storyteller and author of 5 books. Each book takes you on an independent journey, as told from the main character's point of view, focusing on the many facets of human behavior, ranging from feelings of guilt, helplessness, death, and denial. She's looking forward to writing more stories dealing with grief, loss, and moving forward. Today, Veronika will speak on her book, Down the Rabbit Hole, A Journey Through End-Stage Dementia. Veronika, welcome. Thanks for being here.
Thank you, Scott. Thank you. I wrote my book after my husband's death. He died in 2015. From diagnosis to death, it was 6 months, and that is because he went undiagnosed for many, many years. And it's very, very difficult to live through. What I wanted to do was to share our story with other people that may be going down the same path. And I wanted to describe our feelings of helplessness, fear, mine and his, and our loss on reality. We both lost reality as he was getting sicker and sicker with frontal temporal lobe dementia. He was accusing me of making stuff up and of not being normal. He was normal. He was the one that went out and worked and was an executive and traveled all over the world, and he was in charge. So obviously I was the one where there was something wrong. So my story, I point out, it's written from two people's point of view. When you get the book, anything in bold is him talking or thinking, and the rest of the typing is me and reality. But I wanted to point out that at the same period of time when something was happening, what he would be seeing and doing and experiencing, and what I would. And the reason I knew all of that was when he had moments of sentience, he would tell me that he remembers what he did. It was like there's a third person in the room standing in the corner watching, and he's the third person watching this really, really horrible man ranting and raving and having temper tantrums and saying bad things. And he said he couldn't stop the bad person from doing it, but he said he just stood there totally unable to grasp what was going on. And it's very hard at the beginning when dementia sets in. It's very, very insidious. It slowly takes hold of you, so nobody really notices where the beginning is. Later on, as you're living through it, things get more and more out of control. And as such, you question, is it you? Is it him? Is it both of us? We also went to doctors, and the doctors would ask him all the dementia questions. He had a photographic memory. He could count from 100 to 1 backwards in any multiple. He could tell you who the presidents and prime ministers were of England, Canada, and the United States, backwards and frontwards. So he didn't have any problem passing any tests. It was just being left at home alone with me. He also didn't want any people in the house but us. So life changed. So my book, it takes you on our journey. I've highlighted the drugs he was on. Probably some of them contributed to his dementia growing quicker than it should. And then I described he had at one point, he didn't wake up. And at that point, we knew there was something really, really wrong. And they called it delirium. I had never heard of delirium before that point. In the hospital, they said he's in delirium. Well, 1 month of delirium, you're not yourself, and it's very hard to watch. What I wrote about was my caregiver burnout, my not being able to cope, both of us being really embarrassed by there being a mental illness and neither one of us wanting to address it or acknowledge it. And basically, here's what we went through, and here's how horrible it was. But in the end, you can choose what to do with it. You can choose to fall apart, or you can choose to rebuild your life and create something from it. The book was a cathartic book. It was written to help me, but in the interim, other people that have read it have messaged me and have thanked me for putting on paper what they were afraid to tell anybody, their loved ones, their doctors, their psychiatrists. I just pulled back the curtain on everything and said, these are the feelings, this is the grief, this is the guilt, this is the denial, this is our life. And I talked to him, and he also eventually told me, what was going on at some point before he had delirium. It's a very hard read, but for anybody that feels that somebody they know is suffering from any kind of dementia, it's probably a worthwhile read because you get the full picture and all the feelings that go with it. And that's it.
Thanks so much, Veronica. And thanks for sharing that. There's some more things in the chat as well. Appreciating your courage to share your story here today. So thank you so much. There is the link there to the book for folks that are interested. If you have questions for Veronica and you've just joined us, I'm going to remind you there's a Q&A button there at the bottom. Please feel free to click on that. If you start off with letting us know which panelist you want the question directed to, you can, Veronica, and then ask the question. We'll get to that during the question period, which is coming up. But one more writer that I would like to share a little bit about Valene Campbell, who's the founder of and managing director of Revita Health Home Healthcare and Wellness Services that provide in-home personal care across the Greater Toronto Area. Valene has a passion and hands-on approach to health and wellness. She's created various wellness initiatives for families ranging from school-age children to seniors in the area of disease prevention and their management. In recent years, she has rediscovered her joy of writing and has now penned three best-selling children's books. Her stories tap into what is traditionally deemed as difficult to discuss topics such as health and social issues. Today, Valene will speak on her book, Grandma's Memory Box. So happy to have you here, Valene.
Thank you. Thank you for that introduction, and good evening, everyone. It's great to be a part of this author panel among so many other very talented individuals. The third book to my series, it's called The Amazing Zoe and Grandma's Memory Box. That was inspired for a few reasons. Unfortunately, my mom is actually living with dementia. She now has been 5 years diagnosed. And in addition to that, I do have a little girl. She's 2.5 years old. And the story was actually somewhat inspired by my observation of their relationship. During my daughter's first year of life, my mom was not involved at all. She was not involved. And I mean, there could be various reasons to that. But once my daughter crossed the second year into maybe the first or second year, things started to change. Mom came out of her shell. She was a lot more interactive, and she was a lot more involved. And they have a great relationship even to this day. And when I started to see that, I started to think about how children are affected. We often speak of the spouse who is the partner to someone living with Alzheimer's disease. We even speak of the adult children who are treating the their parent or grandparent. But we fail to speak of the children who are part of these families who actually perhaps need support too. And that's what the story is about. It's a little girl who goes to visit her grandmother and notices various changes that are happening with the grandmother. Someone asked me a really good question, and they asked, did the mom know that the grandmother had dementia? And I left that up for the reader to see, but what you can gather is that the mom knew, and the daughter had to, which is Zoe, had to find her way in learning that grandma has dementia. And it's just there to support all families. This is a book and also a tool for parents to learn how to explain dementia to their young ones in a very easy to understand manner. And that's the inspiration behind this book.
Amazing. Thanks so much, Valene.
Thank you.
And we're getting a fair number of questions in the Q&A, so I'll remind everybody again, if you have a question for a specific author, please feel free to type their name and follow that by your question by tapping on the Q&A box at the button, or the button at the bottom, and we will come to your question for sure. I want to kick off with a few questions just on some of the things that we heard, some of the common themes that emerged. So the first area I wanted to dive into, and maybe Larry, you can pick this up, is around the myths that persist around dementia and what it means to have the disease, and why it's important to address that, the confusion around that, and this education piece that we're doing by doing this panel, but that all of these books serve that educational piece. So I just want to throw that out there for conversation.
Well, I could comment on the myths that I think are problematic. I guess that as a epidemiologist, we think about, you know, what's the chances of this occurring? Is there a 3% chance or an 80% chance? Well, the myth in the community about genetics is quite amazing, because it's primarily, as our book shows, it's primarily the environment that leads to this. It's not genetics, and so that's something we've got to deal with. And then the second one is the contrast between those 4 areas of functioning and memory. You notice memory is not on that list, but you know, memory is part of it, but it's more than memory. It's being able to make decisions, etc. So, you know, the public goes, you know, if you forget your keys upstairs, does that mean you have dementia? Of course it doesn't, you know. But so those are 2 things that I find really frustrating, because it leads to many of the wrong conclusions amongst people, and they forget about those 4 areas as being what it's all about. It's not, and I'm talking about the public. You know, if you're a diagnostician specialist, well, of course there are many aspects to these diseases, and that's what we expect them to be able to sort out. But as far as the public concerned, emphasizing memory and genetics, I find I don't think that's appropriate.
Thanks for that. Other thoughts from the panelists on that notion of the educating the public, or myths that you think persist? Cool. I'm gonna switch gears a little bit. There's a couple of questions in the Q&A for Veronika, and I had one as well about your experience. And this is one that I've often asked about for families, because it's really hard to understand how difficult it is until you're in it. And then when you reflect on it, which is kind of what the process of writing is about, you see things a little more clearly. Do you remember a time, or can you tell us a little bit about that moment when you realized this, you were in a different place altogether? Everything had changed, and kind of wasn't going to be the same, and maybe talk a little bit about that experience.
Yeah, there were little things that were happening, and I thought, you know, he's having a hard day at work. Things aren't going well at work. He's traveling. Little things were adding up. And then we went away for the weekend. We went up north towards Algonquin Park. We were coming back. We were driving down the 400. No traffic on the road. It was, you know, just any old random weekday. And suddenly he started speeding and speeding and speeding until the accelerator went all the way down, like to the bottom. The car couldn't go any faster. By that time, I was freaking out. He wouldn't listen. And he was kind of hunched over the steering wheel a bit. And he was saying, there's stuff on the road. There's stuff on the road. And he was seeing stuff. And when we got home, I got out of the car, and I never got into that car again with him again. And I just said, this is crazy. An hour later, he told me I was making it up. But that was when I really realized there was something wrong, and I'm not getting in the car with him. And I asked his doctor, and he told the doctor I was imagining stuff. But a whole lot of little things before the big one.
Right. And there's a question in the Q&A, I think is a good follow-up to that. It's such a difficult story. I mean, and from that moment, it gets even more difficult. But what kept you going? Was it?
Before he got sick, when we got married, he took care of us as a family. He was a loving father, a loving husband, a kind man. I felt when things were going off the rails that I owed it to him, that he took me for my good, my bad, my everything. Now it was my turn to look after him, but nobody knew how bad it would be or how long it would go on. And he also acknowledged what I was doing, and he at times thanked me, and he said he doesn't know how I can do it. There were times even towards the end when he was kind and sweet, and those are the things I try to hang on to, not the bad things. But it's when you're married, you know, if you marry somebody and they're bad from the beginning, well, if they get sick, you can walk out easier. If you marry somebody and they're wonderful, how do you leave somebody that's wonderful and they're sick? You can't.
Yeah, I want to come back to the children in the story, because this is a disease that often affects everyone, and Christiana and Valene, both of your stories touch on that. They also touch on the issue of color and race, and so I want to touch on the intentionality of that and why it's so important that families are able to see their narrative reflected in your stories. Maybe I'll start with Valene.
Yeah, sure. Very important question, because I know in recent months and even maybe the last year or so, a lot of conversation has been around the importance of representation across the board, but namely in children's literature. And when we look at what the purpose of children's literature does for a young person or a young reader, it's one of the first touches that they have in understanding their culture, understanding who they are, and how they relate to the world. And I noticed, of course, you know, over many years growing up, even myself, when I was reading literature, I didn't see representation. In fact, it's sad to say that I became accustomed to not seeing myself represented, not understanding what that damage held or did over the years. And I knew it was something that I wanted to change, of course, have a character of color, show stories that don't always talk about trauma. I mean, although this is a difficult topic when it comes to dementia or Alzheimer's disease, but this is a disease that affects all. There's no barrier to color when it comes to Alzheimer's disease. And I think it's really important in children's literature that we share all stories, that we share characters experiencing everyday life, all areas of difficulty, all areas of happiness and joy. And I know specifically in marginalized communities, or those that have been traditionally marginalized, we often don't talk about how dementia and Alzheimer's disease affects those communities. And it's prevalent. It's prevalent. There are some studies that show that those of marginalized communities are misdiagnosed more than any other group. And with that, it's important to at least start the conversations, making sure that people aren't experiencing misdiagnoses and underdiagnoses, right? Mm-hmm. So children's literature plays a role in so many aspects of course, the representation, as we spoke about, an introduction to embracing self and understanding your importance in this world all the way up into adulthood.
Yeah, so dementia in itself is a global epidemic, but it's very well misunderstood, as Larry had said. A lot of people don't know the difference. It's like, oh, my loved one has Alzheimer's or they have dementia. So it's very important to, you know, break it down for everyone, to explain, educate the public at large, because when you don't know what you are dealing with, it's more difficult and it makes it more scary. And that is why, for me, like with children, when you write to children through the eyes of children, hoping that, anyone that picks out that book will get something from it. It makes it less threatening and it makes it more easy to digest. Someone actually told me, oh, I actually read a full book when I picked up your book in the last several years, so that is the goal, to start this conversation really early from grade school. And also, children are often ignored or overlooked in the whole process, but they are part and parcel of the whole journey. They are just as scared as the adults, but children can bring a lot into the picture. Like I have actually written 3 books. I'm going to borrow a line from my 3rd book, which is about mixed dementia. When Lexi tells her grandmother when she was moving into a facility, and she says they used to have, dance parties. And she said, Mom, Grandma, would we ever dance again? The grandmother said to her, dementia sometimes make me forget about things that I love to do. Will you remember for me when I forget? So children can play a great role, just like Annie did when grandmother was diagnosed with dementia. She's put together a scrapbook. She started to write down stories and things that grandma talked about and stories, so that when grandma got to a point where she did not remember, they were able to get that scrapbook for her to remind her of things that she had done. And on a particularly difficult day when grandma was really sad, that was the day that Annie presented this book to her, and it brought a smile to grandma's face. So I think that this is a conversation that we need to start at very early stages as well, globally. Like, let this be a conversation starter for everyone. A lot of people that I know that are going through dementia, they struggle because it's such a difficult thing to diagnose, even if you're a professional at the beginning, because one day your loved one is completely lucid and they are fine. The next day they are doing things, accusing you of things. So some people start to feel like they are pretending, they are intentionally hurting them. And this is where that strain in relationship comes in, where by the time people move into facilities such as mine, family involvement become non-existent because the caregiver is burnt out and completely angry at their loved one.
So that's an excellent line of question, and I'd love to bring Larry into this as well. What do we need to do better in Christiana in communities with to support families to get through this?
So, well, I wanted to say again what I said in my slide deck, and when I talked before about the myths. There are these four areas of functioning that are essential for life, and even driving. So driving's one of them. And this makes people very frustrated when they can't do it, and all the anger and things that people are talking about. And then there's your financial affairs, which is terrible. Like I have someone I knew who had dementia and went to the Ford store and they sold him a new car. So that's an issue. And then further to that is taking care of your health. If people are unable to do that, like they don't take their medication or they don't seek out medical care when they should. And then finally, the issue of living alone, and we know of people that are either dangerous to themselves or to others. They leave the gas stove on or whatever. So those are 4 things that the public should know about. And then, like I said, memory and executive decision making that we talk about, they're all part and parcel of those 4 things. But if more people in the public knew about those, and then that would, what we argue in our book is that would increase understanding about dementia, and also how we approach this with the people we know and love.
Christiana, and what can we do?
Well, I think there should be a 3-pronged approach. So it should be the healthcare system,
yep,
the community, and the government. So the healthcare system tend to fail a lot of people. The primary care practitioners are usually the first point of contact. I think they need to have a lot of information so that when they first see somebody who is going through a dementia, they can provide them with those resources. First and foremost, get them through a system where they can get properly diagnosed. Like in Scarborough, the Scarborough Health Network, we have the Gain Clinic, there's the Toronto Memory Clinic. And let's send them there. There's the Alzheimer's Society that has a lot of information and support system for these individuals so that people don't feel lost. And then what do we do as a community? From the very point of, like I said earlier, misinformation causes fear and misunderstanding. This is what leads to stigma. We need to, as a community, learn more about dementia so that when we know what it is and we know of someone, because it's an epidemic now, I think almost everyone knows of someone who has dementia. We can kick in a plan to help those people, be it, offering care or bringing a meal to help that person, or even, paying for a PSW to go give them a break. And as for the government needs to fund more projects and especially caregiving. One of the highest trigger for burnout is lack of finances. So caregivers are not paid. Maybe the government can fund more programs to pay caregivers so they can take care of their loved ones longer. Respite care programs, both day and overnight respite care. The nursing homes are, they have a long wait list. Retirement homes are available for this type of care as well. So it is important that the government, provide more funding. And as a whole, we just need to be able to respect these people more and, give them that dignity that they deserve. We should not only see them, we should hear them. Just because you've been diagnosed with dementia doesn't mean you don't know what you are doing anymore. So we need to enable these people with increased abilities and also support their individuality and help them have a purpose to life.
Great, thank you for that. You sparked a thought, and it's sort of another question I had here that I know Valene has a lot of experience with and is passionate about, and that's sort of getting his advocacy within the health system. So you mentioned community and government and support, and oftentimes we have to try and find our voice in this system of experts that don't seem to be, sometimes don't seem to have the answers we might expect them to, or they conflict. Can you talk a little bit about that, Valene, what your thoughts are on finding your voice as an advocate within the health system?
Sure. You know what? I understand that it can be perhaps challenging or scary. Let's just use the word scary sometimes in speaking up. Perhaps it just may be not your personality normally, or because we've heard of the white coat syndrome. In speaking to healthcare professionals, you feel, okay, this is the professional, how dare I ask or challenge? But you've got to come to a place of feeling comfortable with the things that you observe. And I'm saying this from a place of experience as well, because unfortunately, when my father first started to notice changes with my mom, and I'll just share this story real quick. They went to the doctor. We observed a few things as well. And my father said, hey, this is what I'm seeing. I've been married to my wife for over 50 years now. And he was challenged and was told, well, I'm the physician here, and I'm telling you she's fine. It's just perhaps stress, perhaps because she's approaching retirement, it's making her angry. And that in turn, of course, made my father very upset because he was certain about his observations. And after that, he decided, what? I'm going to shop around for a different physician. And there's no tie. You don't have to stick to the same person that you're not feeling comfortable with. So that was one aspect. Switch healthcare providers. And moving forward, when it comes to visiting the doctor or what have you, come prepared with your questions. Don't feel shy that or embarrassed that you did a Google search. It's okay, because where else are you going to get your information? You should always walk in feeling somewhat informed, and have your list of questions, have the list of observations that you feel or that you've seen or that you feel yourself, because it's not always about someone else. It could be, hey, doctor, I'm feeling forgetful, or I'm feeling whatever's happening. Be the voice of yourself. Understand about, for example, your own health insurance and what have you. What health insurance benefits do you have? What can you tap in and access if that's what you have, if you're still working? Maintain your own records. That's really, really important. Document when you go, what you said, what was the response. Have a little book. That's really important as well. Of course, know your rights, because you do have them. And if there's any treatment that's offered that you're not comfortable with, be sure to question that as well, and voice your opinion on that treatment. But do keep in mind that the systems are there. There are systems that are in place to try to help support and guide, but at the same time, you have to know what you're supposed to be getting from the systems that or organizations that are in place. And you also have to know that your voice is needed, whether it's for yourself or for your loved one, because that will also dictate the level of care, the continuity of care, and the results in the end.
Great, thank you.
Mm-hmm.
I'm going to turn it over now to the folks that have been listening with us. Thanks for being patient. If you have more questions, please drop them in the Q&A. The button is along the bottom of your screen, and we will try and get to as many as we can over the next 30, 40 minutes. We have a bunch for Larry around some of your propositions and questions about the disease itself. And we have one for Valene, which I'm going to start with because we're with you already. Do you think that kids' interactions with people with dementia, is that helpful for them?
Is it not helpful, you said?
Is it helpful for people?
I think so. I know it's important to temper it as well. I'm going to say this again, based on my own experience. And I know everyone's experience is different, but when, for example, mom is going through a really rough day, okay, a really rough afternoon, she's very aggressive and, just very, very aggressive, I'd say, that's not a time to keep the child all in that presence, right? For me, because we now live together again. So in those moments, I remove my daughter and, we work with mom, meaning myself or my sister, to try to help, mom calm down. But I think it's important for kids to be aware of what the diagnosis is, so that way they don't internalize when grandma or grandpa are having a bad day. And it's very easy to do so. We do it as adults. We internalize when perhaps our loved one is feeling aggressive and, acting unkind towards us. So of course, a child is going to have the same feelings. So it's important to explain to them what some of these behaviors are. It's important to explain that it's the disease, it's not your loved one. I think it's also important to help them engage a little bit more, because children are magical. They have a way of calming us down. They have a way of putting smiles on our faces. And when you teach them that, here's how you can support grandma or grandpa, it creates a good experience for both of them. Both grandma and grandpa have activities to participate. They still keep a connection and a bond going. So yes, I'd absolutely advocate for that connection to maintain.
Thanks. Over to Larry. Larry, I got a couple of questions for you on the brain health angle. One, what are your thoughts on a CPAP machine, and will that help you keep your brain sharp with the extra oxygen to the brain?
Okay, you want me to answer that one first?
Sure. Well, I'll give you the second question, just so, and maybe you start mulling that while you tackle the CPAP.
Okay.
The next one is around vitamins and mineral supplements, and what might they do to help prevent or mitigate the impacts of dementia?
Okay, well, the first one is on a continuous positive airway pressure. That's what CPAP means. And I started using one about 6 years ago because I looked at the evidence about them, and they are the more we learn about them, the better our cardiovascular health. They really help you with your blood flow, and that's to the heart and the brain. And if you are having trouble with staying awake and not sleeping well, then go to your family physician and talk to them. And if they refer you to a sleep doctor, you should go. I learned that by my own experience, that it's not trivial, the whole process of getting to the point where you have a CPAP machine in your house. There are many steps. You have to go to a sleep clinic, which is pretty inconvenient because you have to stay there overnight. You have to book it, and then you have to go back to the family or the sleep doctor to have your CPAP pressure diagnosed and then prescribed. Then you have to go back to the clinic and have that put on and see what they have to see what that does. And then you think you're done, and then they say, well, there's a CPAP equipment store down the road. You have to go there and buy your equipment. And then you have to take it home and decide whether you can use it or not. And there's many different types of equipment, like the kinds of face masks you use. And then you've got to persuade your spouse that it's worth doing because they think you're from Mad Max. So it just goes on and on. So CPAP, just remember that it's going to really, if you get to that point where you're prescribed CPAP, then you definitely should use it. But and the compliance is terrible. Like only about 25% of the people that are prescribed actually use it on a regular basis into the future. So CPAP, yes. The other question was vitamin intake, and that one's an area where there's nowhere near the kind of evidence there is for CPAP in terms of what the effect is. And one thing to remember is that we don't really know what a vegetable salad contains, and always be skeptical that a company that's putting it all into a pill can really cover the gamut. So my view is that I try to eat a salad every night and know that all the micronutrients that are in the environment that we know that are known to be helpful for the health of people, we're consuming that. Even multivitamins, are we missing some, is the way I think about it. And the research is terribly problematic because people don't always remember their food intake and their vitamin intake. So the research is problematic in terms of knowing what the consumption really is. And then the second problem with the research is that we don't have regulations in Canada that are really effective for over-the-counter, like things that people can go in to a drugstore or a health food store and look at the label and then think that that's correct, because Canada, United States, other countries don't force those companies to really do the kind of research that they claim they can the claims they make on their labels. And so I'm not a big fan of multivitamins and different particular vitamins that you think you should take because the label says so, or the health food store. That's not to say that you should ask your family physician. They know, or your pharmacist, they know the things that if you have any kind of condition, and elderly people have at least 2 or 3, they can tell you what are the types of things you should be taking that's in a pill box in a pharmacy, and they can also tell you the ones that you shouldn't take. And our book talks about the need for people to be wary of anything you're ingesting in the terms of pills. And I like that comment about write down what the physician said. That was really, you got to keep track of all these things. So that's my comment on multivitamins.
All right. Thanks, Larry. Over to Christiana. Question from Delma, who's listening along. She wanted to know if Alexis Lodge is for African descendant patrons.
Absolutely not. It's for everyone. It's mixed culture.
There you go. Can you tell? It's actually. Can you tell us a little bit about Alexis Lodge?
So Alexis,
I want to open the door to that because I think you do such great work. You should
thank you.
You should brag about it a little bit.
Yes, I think I will too. So Alexis Lodge is actually a family. It's a home-like environment where our residents are able to live in a safe, comfortable, loving and caring environment where they can be themselves. So our care levels are centered on the individual. So we customize the care. So it doesn't matter what stage of the disease you are at, we just take care of you where you are. We make you feel comfortable. We enhance whatever it is that you can still do. We have residents sometimes that are helping to cook. We have residents that can fold laundry and so forth. So it's just like a family environment. And we also keep our residents to the end of their life. So they live there because this is the home that they've come to know. And we do not only look after the residents, we also, support the families, because like we said earlier, that this is a family disease and it's a communal disease. So even people whose loved ones have passed away, they're still very much involved with Alexis Lodge. Prior to COVID, they will still come and visit and spend time with us. But in the light of COVID, they come and drop off treats for the residents and everything. So most times when people have dementia, they may experience behaviors. We do use medications to take the edge off, but we do not over-medicate our residents. They still have that quality of life. They're still able to participate. So even when they have difficult times, we don't go running to shush them with medication. We allow our residents to express themselves. Because it's such a small community, it's a small home. It's just like having a family of 10 people. We can see the behavior start to escalate, and we are able to help them de-escalate. It could be something as simple as saying, would you like a cup of coffee? Sometimes people with dementia don't sleep at night. That's okay. We allow our residents to come downstairs and be with the staff. We offer them, hot chocolate and give them a snack. And when they want to go back to bed, they go back to bed. So basically, we're giving people with dementia a voice and helping them to have a choice and to have purpose. So it really gladdens my heart when I hear family members say, you know what, my loved one is doing much more better at Alexis Lodge than they did at home. That is always something that gratifies me.
Thanks for that, Christiana.
You're welcome.
I want to put this out to anyone. You may know of this, and it's going to be an opportunity for me to tell you a little bit about the Alzheimer's Society as well. I have a couple of questions. One, is there a comprehensive guide or questionnaire that can be used in the journey, specifically in the healthcare field? I had a tough time navigating to get support and resources to take care of my husband when he was bedridden and unable to communicate. So I'll put that out there to say, is there are resources on the Alzheimer.ca website or Alzheimer's Society of Toronto's website at alz.to that might be useful. One of the things that I often tell people is there's nothing like connecting with other people who have experience. So I would encourage you to connect with us at the Alzheimer's Society. All of our programs and services are free of charge to caregivers. We can sometimes help you get connected to other caregivers through education sessions or support groups to help navigate. We have navigators that do navigation, so you can book an appointment to talk to them to get some help sorting things out. So I put that out there as a bit of a plug for the Alzheimer's Society. We are here. You don't need to prove a diagnosis. Call us up. And you can always reach out to me direct, scott@alz.to, with anything you might have. So, but are there other resources? Let's talk about that. The resources that might be available out there in the community, or things that you felt really helpful in your journey.
Can I interrupt?
Yeah, please, Veronika, jump in.
When my husband was finally diagnosed, it was December to June and it was gone. In January, I joined an Alzheimer's support group. That was invaluable. I didn't know they existed. I went in for an interview, and then they put me in the next available one. And then they had one for the caregiver and the person to go to. I talked my husband into going to that. And just going to a support group is really, really wonderful. And you go there, and it's not like AA or anything, it's different. But you go there and you don't feel as overwhelmed and overburdened, because they taught me coping skills that I didn't have, which was like invaluable when they say, when this happens, this is what you do. You don't overreact, you don't underreact, this is what you do. And I don't know where I would have been without that.
Yeah, thanks for that.
Yeah, I think there's a huge gap, because there are a lot of people that are dealing with dementia, like the older couple who have no children, don't know how to navigate social media. There are no longer phone books. So, and the family doctors, their 4 points of care, are not providing enough information for these people. I think we need a massive grassroots campaign. I think dementia should be like, should have that public announcement from time to time. We should start having more education. People that deal with dementia, both the health practitioners and even the facilities and the Alzheimer's Society need to come together, provide literatures so that family doctors can give this out. People don't know how to find help. You know, most times by the time they are burnout, like it's either that staff is person with Alzheimer's is becoming aggressive with the loved ones, and then they end up in the hospital, and then the hospital is sending them out to a facility, whereas a lot of this could have been prevented from the outset. So I think there's a huge gap, and the thing to do is to think of how to get information out to more people who don't have access to contact the Alzheimer's Society, for instance.
Mm. So I'm going to switch gears slightly, and it's going to be another small commercial for the Alzheimer's Society. The comment in the chat was, I think that healthcare workers, for example, PSWs, RPNs, should be trained to work and educate, understand the residents who have dementia. It would be helpful for both residents and staff. That was from Cheryl. Thank you for that, Cheryl. We couldn't agree with you more. At the Alzheimer's Society of Toronto, we have a training program. In fact, it's available across the country, and it operates under the brand You First, and takes a person-centered approach to training frontline healthcare workers, predominantly PSWs and RNs or RPNs, in being able to communicate with, strategize, understand, and provide just top-notch care for people living with dementia. So we couldn't agree with you more. So look for that You First brand and in the training, or ask your provider about the kind of training they do provide, because it is such an important piece of the equation when it comes to care. But I would put that out to Christiana and Valene as well, again, in terms of your work, how important you think it is to have that education for frontline workers.
I think it's critical, and even outside of frontline workers, something that just came to mind is even police. We've heard time and time again when people have a mental health crisis, and I'm not only talking about youth, because sometimes it's a senior who's having a mental health crisis, and there's not enough information in how to deal with those situations. I know for a fact that there are, especially I'm more in connection with Alzheimer's, this Peel region, because I'm in Peel. There are crisis lines. Someone asked a question about that. Should they call the police when their loved one is having a mental health crisis? But again, what Christiana said, there isn't enough of a plug about the separation of the two phone numbers that you call. You call, of course, police 911 for certain emergencies, but you can also call a different number for crisis, mental health crisis, which would kind of fall under the umbrella of dementia and Alzheimer's disease. So I agree wholeheartedly. We need to keep pushing the conversations, continue to have training for the PSWs, the RPNs, those who are first in line. And again, that's why we call on all of you to be advocates as well, to speak to your doctors, because when you continue to have these conversations in the terms of advocacy, they will start to understand that this is something that they need to tap into as well, and better understand the symptoms around it and how to better direct their patients to the care that's out there. That's a huge problem that I've noticed. Yes, you'll be able to receive the medical care, but they're not able to offer suggestions about the systems that are in place, such as easy as the Alzheimer's Association right here, or society that we have right here.
Yep.
Yeah, I just want to actually say that my staff have all received training from the Alzheimer's Society, and there are a number of training, and there are trainings actually for families that is offered by the Alzheimer's Society as well. And also, just to touch on what Valene said about the police, there are police officers that are attached to certain units for there are mental health nurses that are attached to the units. Unfortunately, there are not enough of them. Just imagine a resident of mine being picked up to spend a night in jail because he violated his restraining order. That is really sad. And that is because there's not enough training. So there's a lot of gaps in the society or in the system that needs to be filled. I think the government comes back into my play here. They need to fund more of these programs so that actually the police, what I realized is when you make a 911 call, you have fire, police, and all different people listening in. Because I had a resident once who wanted to kill himself with his radio cord. When they told me that, I'm like, oh my God, that's a suicidal thing, and I had to call it in, right? Because he actually had a plan. But when I made that call and they asked me ambulance or police, I said ambulance. The minute I mentioned that he was trying to kill himself, the police took over the call. And within minutes, I had police officers in attendance. So they do work together hand in hand, but they don't have enough funding or enough resources. I think this is so important that we should have more of those mental health nurses attend to calls.
Could I make a comment?
Yeah, please do, Larry. And I'm going to, Pooja asked a question in the Q&A about the name of the program Christiana just said, and it's called You First for Families. I'm going to dig out a link and put it into the chat. But yeah, please go ahead, Larry, jump in.
Well, I'm going to talk about another program. Dr. Linda Lee in Waterloo has developed what she calls the MINT clinics. And the really important thing to remember about them is that she recruits family physicians across the province to set up a practice in a community that specializes, a family physician practice that specializes in the diagnosis and post-diagnostic care of people with dementia in primary care. And I was involved in a Health Quality Ontario study 2 years ago, where we were able to demonstrate that people that go to those practices aren't referred to specialists as often because the family docs can do it themselves. They reduce the number of admissions to long-term care. They reduce the number of visits to the emergency room, and they increase the use of home care. So they do well across the board. Unfortunately, only 15% of people of the 175,000 people with dementia in Ontario have family physicians that are trained in that group. So switching over to the other side about, well, what's government doing? I realized in the fall that the Conservative government didn't do anything to shut down any dementia programs, but they didn't increase dementia programs. And the Alzheimer's Society has benefited from their support across the province government support for social workers in all the societies and the First Link program. But Linda Lee's Mint clinics has sort of been ignored. So having been a political science grad, I thought about, well, this is an election year, right? And if we're going to change Ontario's approach to dementia, it's got to be on the party platforms. So I have a small group that, including Linda Lee, who are working with, I'm proud to say that today, we're working with all three party platform writers. Someone has to write what the platform is. So we spent the last 3 months finding those people who are writing the platforms. And one of the first discoveries was that dementia wasn't in them. They had care of older people, but nothing about dementia in those platforms. So our goal is to get dementia into the discussion and dialogue about this upcoming election on June 2nd in Ontario. And as you know, when a party gets elected, then their marching orders are what they said in their platform. So the premier of the province, who's elected, looks at the platform and says, okay, Minister of Health, what did we say in our platform? If dementia is not in that platform, their letter to the minister about what they should do during their time as Minister of Health, it isn't mentioned. So the platform is a very important piece of the political process that all of us need to be asking questions of anybody that we know who are leading any of the parties in their campaign over the next 3 months. We should be all out there saying, well, what about dementia? What are you going to do as a party?
Yeah, and that's something the Alzheimer's Society is also active on, as you know, Larry. We've got I've been doing MPP meetings all week, actually, plugging our pre-budget submission. So I definitely encourage you to talk to your MPP, let them know dementia has to be on the agenda, and talk to any candidates. It's not really even a partisan thing. Any platform needs to include a serious look at dementia for sure. It underlies so many issues that are top of mind. Long-term care, dementia is a part of that. Hospitals, dementia is a part of that. Alternative levels of care in hospitals, dementia is a part of that. Long wait times in the emergency room, dementia is part of that. Community care, dementia is part of that. So it's one of those issues that tends to get kind of glossed over. So definitely put a plug in and share your story. Speaking of sharing your story, I want to jump back to Veronika for another question from the Q&A chat. Veronika, did you have outside help to balance your time and your own self-care when you're dealing with balancing the care for your husband? And did you ever use gentle, persuasive approach?
He didn't want anybody in the house, not a cleaning woman, not a health person, nobody. I handled it all. As such, I lost a ton of weight. Didn't have a ton to lose, but I lost weight, got down to 93 pounds, was super nervous and edgy, and I was having a difficult time coping. There was nobody to help. The only time we found help was after he was diagnosed, and I went to the Alzheimer's support group, and then they organized for nurses and workers and people to come in, but he didn't want them in, so I'd pretend they were my friends. They'd tell me how to cope. But up until then, almost the last year of our life together was difficult. Nobody was allowed in the house, and he didn't bathe, so I tried to get him to bathe. I tried to do things, and he just kept saying it was me, not him. But no, I should have been stronger. I wasn't. We should have done things differently. We didn't. That's what I wrote about. I wrote about all the regrets, all the sadness, everything we did wrong. And we finally went to the psychiatrist, and he said to my husband that I will die before him. And if he wants somebody to take care of him, he has to be nice to me. And he gave him Wellbutrin to calm him down. So that was the care. Yeah. Life is hard, but you figure it out. I wish we had support sooner. I wish we knew sooner. It would have helped. And we were both in denial too.
Mhm.
Yeah.
Yeah, that's such a hard situation. I'm trying to think about what would it have, in retrospect now, and this is sometimes a question I'll often ask families, just as a service provider, I'm always trying to figure out, I've heard that so many times. I wish I'd heard from you. I wish I'd known, or I wish looking back, what's something that you wish had been there that you think we could actually do as a community, or us as a health service provider? What do you think there's one thing that if you could make happen by the end of today, for sure, you would want to have in place for someone else who's there? Or what's one thing you would want them to know?
If the person is behaving irrationally and they're telling you it's you, not them, don't believe it. Don't get bullied. If you go to a doctor or psychiatrist and they do the dementia test on the person and they pass with flying colors because they know every answer, because they just know it. I wouldn't know the presidents or prime ministers, but anyways, you don't buy it. Maybe go for help. If I had gone to an Alzheimer's support group 1 or 2 years sooner, I would have handled things better. We both would have had a better quality of life, and we wouldn't have had the anger. So my thing is, go to support, find support. Even if you don't think you belong there, go start talking. And when you start talking, they'll say, yeah, you fit in, or no, you don't, but go. That's the big thing. Don't hide out in your house hoping it'll go away. It doesn't. We didn't even, my son is 32 right now. He was 25 when his daddy died. We didn't even tell him. And we didn't tell him he was off at university. He'd come home and he'd say, what's going on? Oh, daddy's tired, daddy's sleeping. We all lied to one another.
Mhm.
And don't do that.
Scott, I was going to make a comment quickly.
Yeah, please, Larry.
Another hat I wear is I'm an educator, and we have ageism in our society, but and over my career, I've heard people say, well, why would you bother worrying about or studying older adults? That it must be pretty simple. But like Veronica's pointing out, it's very complex. It's one of the most difficult things to understand in terms of how we deal with this as an individual, as a family, as a community, as a society. And we need to attract more people who are smart at university and colleges to work with us. That would be my plug.
Yeah. Okay, I want to try and grab one more question from the Q&A. We might get two in, but I want to touch on palliative care a little bit. There's a few questions around palliative care, but I want to touch on your experiences or your perceptions as care providers, or having gone through sort of those end stages of the disease. Share with me your thoughts on what needs to be in place around that, what your experience of it was, what made the most difference in terms of comfort for the person with dementia, the family members. I'd love for you to share a little bit of your experience about that. And that's open to anyone.
Can I talk?
Please, Veronica.
Yeah. My husband was in palliative care for 3 weeks. He was in the hospital for 30 days, home 17, then in the hospital for 35. And initially, we had a do not resuscitate that was signed 20 years ago, 10 years ago, and in December after he was diagnosed. So I had all 3 originals, We gave them to the hospital, do not resuscitate, do not bring him back. So in delirium, had he passed away 2 months earlier, it would have been a kindness to him. It would have been a kindness to me. He was in palliative care too long, and it was just too heartbreaking for everybody and too painful for him, even though he was unaware. So they should respect people's wishes. And I think things have changed now, I'm not sure, but that was my experience. And both he and I, we both wanted the same result, you know, for him not to be in pain.
Mm.
Just from the experience that I have with home health care, I definitely know, at least from our standpoint, we do respect end-of-life care. As you mentioned, Veronica, there are orders that are in place, and we have to do our best to make sure. And even outside of that, some of the other healthcare providers that I collaborate with, or the home healthcare providers, everybody now really puts a lot of emphasis on the family's wishes, and I've seen better support personally. So Veronica, that's a great point as well. We have to make our wishes known early, and try to enforce them along the way.
I just want to say that having done hundreds of palliative care for our residents, I find that love and is the ingredient that you need. Our residents, actually, I have a quick story where someone was sent back to die at Alexis Lodge, but with the love and attention, he went on to live for another 4 years of quality life. And I have had a resident now who has been palliative for more than 5 years. Because of the stimulation that they get, it really helps. Like this lady can still sing and still, we keep our residents involved to the very end when they can no longer be part of us. We bring them out in the wheelchair, and they still hear, just the noise and the love, and it just it gives them that purpose and gives them that quality. When it does come to the end of life, when they are, in their final stages of death, families are there with them. Like I have families sleeping over, so that is so important to just surround them with love until the very end. And we've had very pleasant experiences with end-of-life care.
I was just going to mention the latest MAID, medical assistance in dying legislation, leaves it open for Canadians to discuss what we're talking about now. That they didn't go down the road of mental health and dementia very far in that legislation, but we need to keep the dialogue going. And of course, the Alzheimer's societies are hopefully going to be giving us leadership on that.
Thanks for that, Larry. That's we questions all the time on MAID, and it's an evolving legislation. So again, another reason to get involved and have your voice heard out there. Thank you, everyone, for being here today, for joining us, for sharing your work and your writing and your passion. Love is the right note to end on, I think. So thank you for that, Christiana, and thank you for Rosemary and in the group. Love and interaction was the secret ingredient in her journey. And we also got a note about this in the chat. All the stories shared this afternoon are gifts, painful as some are to all of us. Keep your resolve to be caring, compassionate to those around us that need support. Great way to sum up today. So thank you everyone for being here. A reminder, a recording will be made available shortly. It'll be emailed to you with a bit of a survey about how this did, how we did today, and how this was in terms of an experience for you. I would love to hear from you, Scott at alz.to. Happy to take comments, feedback, anything if you want to share about what we've done here. We're always looking for new ideas and feedback on the conversations that we do have. Arlene Willis is also a lead on this project. She'd love to hear from you as well. willis@alz.to if you have feedback for her as well. Either one of us will be happy to connect with you. Keep informed of upcoming sessions at alz.to. I've sent a couple of links in the chat here for various things that you can sign up for, but alz.to will take you to all of that. Please sign up with us if you want to hear more about some of the other conversations that you have. We'll share all of the links that were in the chat. Thank you to all of our panelists once again. And we look forward to talking with you again next time.
Thank you.
Thank you.
Thank you. Thanks, everyone.
Thanks, everyone.
Thanks, Scott.
Have a great night.
You too.